The event will begin now.
Good evening, everyone. Welcome back. For those of you who have been at other town halls I've run, nice to see you back after a little hiatus. And for those who have never joined us in a town hall from Senator Krueger's office, I am Senator Liz Krueger. Nice to see all of you or know that you're there. And we are having this event on both Zoom and Facebook, or you can call in for the discussion this evening. Before I get to the proceedings, I want you to be aware that we have closed captioning. As a viewer, you have to activate closed captioning to view the text on your device. If you're in Zoom, click on Live Transcript in the meeting controls to start viewing closed captioning. If you're on Facebook Live, you'll see a setting button in the bottom right-hand corner of your video. Click Closed Caption, the CC, to start viewing closed captioning. It's as simple as that. The New York City Health Department wants you to know it's very important to get a flu shot this year. Oh, you thought we were just talking about COVID, but we've got the flu to deal with as well. If you are older than 65, a nursing home resident, and people with underlying medical conditions, it's extra important for you to get a flu shot in the context of a pandemic going on with COVID that also impacts your respiratory system. New York City Vaccine Finder now allows you to find pharmacies and other locations where you can get a flu shot in New York City. And we're putting that website address in the chat. The New York City Health Department also is urging anyone who attended the Electric Zoom Music Festival on Randall's Island over Labor Day weekend to get tested for COVID-19, regardless of their vaccination status. The Health Department is investigating a cluster of cases from the festival and at least 16 individuals who have been identified as part of the cluster. You can find a testing site at nyc.gov/COVID-test. My office has been informed that there are short lines to get tested in New York City Health and Hospitals testing sites, shorter lines, and results are coming back within 48 hours. And now we're going to move to tonight's event. COVID-19 updates, Delta, vaccinations, and other mitigations. You should know that this event is being recorded, and everyone who RSVP'd for tonight's event will receive an email of a link to the video a couple of days after this event. Overview of this evening. Tonight we're going to provide updates on the state of the Delta variant, breakthrough cases, the status of booster shots, and vaccinations for children under 12 being authorized, important safety practices, and what might come next as the pandemic changes and progresses based on the most current policies and practices. I'm very pleased that Dr. Celine Gounder, an infectious disease specialist and epidemiologist at NYU Grossman School of Medicine and Bellevue Hospital, has again been able to join us tonight to answer questions. She's been on before, and she's very popular because she's so good at answering the questions that people come up with. She has an extraordinary ability to translate complicated scientific information to make it understandable to people like you and me. Dr. Gounder will frame the conversation briefly, and then we will devote most of our time to questions you have about COVID-19. I will moderate the Q&A portion of the event. Many have already submitted questions. You can still submit questions through the Q&A function on Zoom and Facebook. Please note that Dr. Gounder will not be able to answer specific questions about an individual's health conditions, but more the overall situation we're facing and what we know so far. And now it's my pleasure to turn it over to Dr. Celine Gounder. Good evening, Doctor.
Thank you so much, Senator Krueger, and it's great to be here with all of you. Just giving a very quick overview because I want to make sure we leave plenty of time for questions, which is really what you guys are all here for. I think we're at an interesting point in the pandemic. We now have multiple highly effective, safe vaccines, but we've hit a bit of a plateau with respect to vaccinations. In New York City, we're doing quite well. We're at over 70% of New Yorkers over the age of 12 who have now been vaccinated. And it really is, as I was telling Senator Krueger and her staff before logging on, it really makes a difference. In the hospitals at Bellevue, for example, Bellevue Hospital in New York, we have about 12 patients with COVID right now. And at the height of the pandemic, we were averaging in the 600s. And so you're really talking about a dramatic decrease in cases. And this is very much in part or very much due to vaccination. We are facing a very different situation here in New York than other parts of the country are facing, in particular states like Ohio, West Virginia, Kentucky, Florida, are facing much, much higher rates of COVID, of hospitalization, of death, and they simply don't have the vaccination rates that we have. So I think there is light at the end of the tunnel. If people get vaccinated, it really does dramatically change the situation. As many of you know, here in New York City, the city has now mandated vaccinations. If you are going to go dine indoors, to a bar indoors, to a gym indoors, and that's really to continue chipping away at that remaining 30% who are not yet vaccinated. A big proportion of those who are not yet vaccinated are the under 12, and we'll get into some of that in a little bit and what the timeline looks like for that age group. Big picture, I often get asked, what are the next 6 months to a year going to look like? And I do think, many of us are watching very carefully what is happening now with back to school, what is happening with back to the office, at least for some offices. I suspect, in particular with back to the office, that we may see a bump in transmission. Not every office or workplace is doing this as safely as, for example, the schools are doing. The schools are going to be testing weekly. There's been a lot of effort put into making sure that classrooms are well ventilated, that they have air filtration. There are vaccine mandates on the staff as well. And so I think schools are going to be some of the safest places to be. But workplaces, it remains to be seen how that plays out. And I think we're going to be watching that carefully in the coming month. I anticipate October will be a quieter month with respect to COVID across the country. I think by then we'll be through this current Delta surge. And then I think we'll see another increase in transmission related to the holidays over Thanksgiving, Christmas, and New Year's. What happens when people travel over the holidays, they're seeing different networks of family, of friends, and that allows the virus to spread through new chains of transmission where it might have burned through other previous chains of transmission prior to that. And so I think you will see a bump in transmission over the holidays. And then I think after that, things will start to get better again. The big unknown here is how much more people will get vaccinated in the coming months. I think you're already seeing employer mandates make a big difference. Where employer mandates have been put into place, we've seen 30% or more of the workforce get vaccinated than were previously. And so it really can have a huge impact in terms of getting us to the other side of the pandemic. So we'll see how much that helps us chip away at the problem. Hopefully it really does get us on the other side of this. And by the spring of 2022, we are in a much more close to normal world. So with that, I will turn it back to you, Senator Krueger, and we can dive into some of these questions.
Great, because we have so many tonight. We're going to start with questions about boosters. So how important is it to get a booster shot once they're authorized? And can you talk about risks and benefits related to booster shots and some issue with cardiac conditions for males?
Yeah, sure. So first of all, with boosters, right now, the only vaccine for which boosters are really being looked at is the Pfizer vaccine. And that's because the Pfizer vaccine was the first one rolled out. We have more data on the Pfizer vaccine in terms of how it's standing up over time. So that means time with respect to waning of immunity and also time with respect to the emergence of the Delta variant. Those are two slightly different factors that might affect how well the vaccine is performing. And because the Moderna vaccine was authorized later and rolled out later, we don't have that same follow-up. So I will first address the Pfizer vaccine. So the FDA met last week to see if it made sense to give booster doses of the Pfizer vaccine to people who had been vaccinated with Pfizer. And having myself reviewed the data very closely, it's very clear that there are certain populations that would benefit from an additional dose of vaccine. The elderly, so for our purposes, people over 65, people who have highly immunocompromising medical conditions. And when I say highly immunocompromising, I'm not necessarily saying people who have diabetes. I mean people who are getting very potent chemotherapy for cancer, people who have AIDS, really immunocompromised people. And then finally, people living in nursing homes really do seem to be at very high risk and could benefit from an additional dose of vaccine. And much of this comes down to the fact that these are populations that are older or have weaker immune systems. And so when they are vaccinated, they have a less potent, less strong immune response to the vaccines. And so that immune response may not be as high, it may not be as long-lived. You can think of it as, when you're 60, 65, your joints and bones and muscles are not as spry as they were when you were 20. And similarly, your immune system is not the same at the age of 60, 65 as it was at the age of 20. And so it just doesn't kick into gear as well in the face of a vaccine, and it may not last as long after vaccination. And so this is what the FDA recognized, that this is the age group, that over 65, that might benefit from an additional dose of vaccine. And now that recommendation is being evaluated by the FDA. They haven't weighed on it definitively yet. And now also today and tomorrow, the CDC are similarly reviewing the same data to figure out what to do with respect to additional doses of vaccine. Now, I say additional doses of vaccine and not booster for a very specific reason. When people hear booster, they think that means, oh, I'm going to have a shot every year for the rest of my life. And that is not what we're talking about here. Influenza or flu is a very different virus from COVID. Most diseases for which we vaccinate are actually given as 2, 3, 4 dose regimens. If you look at measles, mumps, rubella, polio, diphtheria, tetanus, pertussis, some of the common vaccines that we give, hepatitis B, these are typically, almost all of them are 3 or 4 dose regimens. And then once you give those 3 or 4 doses, you're done. We anticipate COVID may be much the same, where it ends up being a 2 to 3 dose regimen. And that will depend a little bit on the vaccine, the population. And so that's why I say additional doses, not booster doses. So that's a bit of the story with the Pfizer vaccine. With the Moderna vaccine, what we're seeing so far is that the immunity with the Moderna vaccine, even in some of these higher risk groups, actually seems to be holding up pretty well. So it's not clear that even in, say, the over 65, that you would necessarily need a 3rd dose of Moderna. 2 may do the trick. And then finally, with respect to the Johnson & Johnson vaccine, we've actually gotten some really good data over the past week from Johnson & Johnson. 1 dose continues to look very good. 2 doses looks excellent and may in fact be end up being an even more potent regimen than Pfizer and Moderna. But what's going to happen now is the FDA and then afterwards the CDC will look at the data from Johnson & Johnson and figure out, okay, do we need a 2nd dose of that? And again, in which populations and with what timing? Oh, and then, sorry, one last part of that question. There was the question about myocarditis, which is heart inflammation. So this is a exceedingly rare, and I want to be very clear, very rare side effect of the Pfizer and Moderna vaccines, the mRNA vaccines, where you see myocarditis. Myocarditis is inflammation of the heart muscle. And where we have seen this is in younger men, so men in their teens and 20s after vaccination. There is a theoretical risk that you may see more of that if you were to give a 3rd dose of either Pfizer or Moderna to younger men. And this is another reason, you have to be careful when you recommend third doses. You have to look at sort of the risk benefit, and where the benefit is very clear is in the over 65 age group, immunocompromised, nursing home residents. And these are not the groups also that are at risk for this very rare side effect. So your risk benefit trade-off really supports giving an additional dose for those groups.
Great. Thank you. So now I have a series of questions. I'm just going to merge them a little bit because they all sort of have the theme. So there's 3 different kinds of vaccines we might have gotten. As you said, right now, they're only recommending the booster with Pfizer because they still haven't come out with statements about the Moderna, and they're just starting about Johnson & Johnson. Is there a reason to mix and match to get your third one a different? You just told us that Moderna seems to have a little bit longer efficacy. So should I, if I had Pfizer before, should I get Moderna, or is that like no? And if I got, Johnson & Johnson, should I get Pfizer? What's anybody's opinion about trying to increase the protection by combining what's mixed in your body, so to speak?
Yeah, this is a great question, and it's something that NIH is actively studying right now. We have seen where we have the best data on mix and match studies is with the AstraZeneca vaccine, which is not used here in the United States. It's used in the UK and other European countries, other Asian countries, and elsewhere. But where we have the best data is a dose of AstraZeneca vaccine followed by either Moderna or Pfizer. And the closest analog to that would be to get a dose of J&J vaccine followed by Moderna or Pfizer. What we see with the mix and batch is that we do see more robust immune responses. And so I think you may see recommendations in the not too distant future about mixing and matching. It's also a reason why, if you're not in one of those really high risk groups, the elderly, again, over 65, immunocompromised, nursing home residents, that it may make sense to wait a little bit longer, because the recommendations may be that you would actually benefit more by mixing and matching with your additional dose than with getting another dose of the same thing.
Got it. And then here's another variation of question. Why haven't the vaccines been adapted to specifically target the Delta variant? This questioner believes Moderna and Pfizer have both available, but that they could change their vaccines pretty easily if needed. Do we know anything about that?
Yeah, so at a basic science level, at the molecular level, yeah, it's really pretty straightforward to switch out, the code. You could think of it as a Lego piece that you're switching out to be tailored for Delta versus the older strain. But then you have to go and produce it. And so then it means having an entire manufacturing plant that is assigned to make that vaccine instead of the current vaccine. And I think that's where logistically it gets more complicated. The other thing that we've seen is that the current vaccines are actually protecting quite well against Delta. The diminution or reduction in effectiveness that's specifically related to Delta is quite small. And so there just hasn't been the need to retool in that way. Had another variant like the beta variant really taken off, and fortunately it has not. But if the beta variant had taken off, I think that might have been a different story, where there may have been more interest in retooling and updating the vaccine for that variant.
Got it. And just jump to children. When might we be hearing about authorizing children under 12 to receive vaccination? Because I think for so many, everyone, they really believe that if we can just get the kids vaccinated, we will have much fewer problems with the schools reopening, much fewer concerns about starting to see these breakthrough cases and serious cases also among children who have immune risk issues, and that sort of life can go much further back to normal if we can just get the kids.
Yeah, I think this is on a lot of people's minds right now. And I have two nieces who are under age 12. One is 6, one is 2. So this is very much on the mind of my family as well. So Pfizer has now finished collecting, or I shouldn't say finished, but they've collected the data that they need for their application to the FDA for authorization of the vaccine in the 5 to 11 age group. So they are putting together that application as we speak. We'll be sending that to the FDA imminently. And we anticipate, assuming everything goes smoothly, that by Halloween, kids 5 to 11 will be eligible to get vaccinated with the Pfizer vaccine. Moderna is really on Pfizer's heels with collecting their data in kids under 12. We anticipate they will make a similar application in the not too distant future. With respect to kids under 5, that's going to take a little bit longer. We think that they will be eligible to be vaccinated in early 2022.
Early 2022. Okay, we're getting there. We're getting there. Let's shift to those populations that still just aren't getting vaccinated. I am frequently told by people who haven't been vaccinated, I already had COVID, I don't need to be vaccinated. Why are you telling me I should be vaccinated? So why do we need all those people who already had COVID to get themselves vaccinated?
Yeah, really important question. So your immune response, if you've already had COVID, those immune responses are highly unpredictable. Some of those people do have very good immune responses, long-lasting immune responses, but many don't. I would say, in fact, the vast majority do not. They tend to be less strong, less long-lived, and by definition, a variant like the Delta variant or the Beta variant, these variants evade the immune response to natural infection. And so by definition, you are not as well protected against infection with the new variant. And so it's really important that you still get vaccinated. You might ask, well, why can't I just get a test to know? The tests that we have for antibodies are not the right kind of tests to really assess if your level of antibodies, strength of antibodies, duration, longevity of antibodies is going to be enough to protect you. Those tests are really expensive tests to do. They're done in research labs and really only in a research context. So there's not a test we could be saying, yeah, for all 350 million Americans, those that have been infected, which is a big proportion of the population, by the way, if you're talking about having to test 20, 30% of Americans to see if they had COVID and if their antibodies are sufficient, that's a huge cost and really not a practical thing to do. And if you think about the amount of blood that they would take to do that test, I can tell you that hurts a lot more than just getting a quick shot in the arm. It's much easier, much less painful to get your dose of vaccine.
So let's say you have been vaccinated twice or with Johnson & Johnson once, and you find that you still end up with a case of COVID. We know that those cases seem to be more mild most of the time. But are these, by definition, Delta cases of COVID, or are there other breakthrough forms of COVID even when you are multiple vaccinated?
Yeah, so what's happened with Delta is different in that it is far more infectious. So in other words, it spreads more easily from person to person than previous strains. And this is because the amount of the virus in the nose, the throat, the mouth of somebody who has COVID, if they have Delta, that amount of virus is 1,000 times higher than if they had one of the earlier strains. And so I think that's really important to understand. So what's happened is you can think of Delta just outrunning all of the other earlier strains. And so now Delta is pretty much one of the only strains we see in the United States. I would say 99% of the time, if you have COVID in the United States, it's going to be Delta. And that's actually true in most of the world right now because Delta, through natural selection, has really taken over. It's just faster. It's more efficient in infecting people than the other variants. And so if you have a breakthrough case, it's probably going to be Delta, just because almost all the COVID out there right now is Delta. And just to be clear, when we talk about breakthrough infections, what we mean is somebody who has an infection after vaccination. That's to be expected because of the way the vaccines work. What happens when you get vaccinated is you have a big spike in your antibody levels, but then you have other parts of your immune system that kick in, and they're kicking in to form memory of the vaccines. And that happens in the form of memory cells. And then your antibody levels go down, but the memory cells are still there. And the memory cells are poised and ready to go. If you encounter the virus again, they're ready to rev up and produce antibody again. That does take a couple days. And so what can happen is you can be re-exposed, you can get infected. And then in the 3 to 5 days it takes your memory cells to kick in, they can nip that infection in the bud. And so you don't get really sick. But it's important to understand that's not a failure of the vaccine. That's actually how the vaccines work. And I think many people were sort of, had false expectations, because you do have this honeymoon period for 2 to 3 months or so after vaccination, where you have very high antibody levels already there. On top of these memory cells. And really what's normal is that with vaccination, what you're really counting on is the memory cells hanging around, staying there really for the rest of your life and ready to produce antibody the next time you're re-exposed.
So someone asked, I had approximately 3 to 4 weeks ago a breakthrough case and I'd already been vaccinated. Mm-hmm. I'm going to hope that that meant that it was not a very serious case. But the question is, so has my vaccination efficacy dropped because I had the breakthrough case afterwards? Or as I just described it, you can get the breakthrough case of Delta, but that triggers your body to actually produce an immune response again, right?
Yeah, so it does not mean that there's been a drop in the vaccine efficacy. And if anything, it's almost like you got a little booster shot through that infection. So if anything, your immune system is going to be even stronger. I think what's fortunate is you were vaccinated before you got the infection. And so you were already benefiting from some level of protection in particular against the virus going into your lungs and to other internal organs. And that's when you get really sick. So no, this is not a reflection of a drop in efficacy. And if anything, your immune system is probably even stronger now.
Great. Okay, so we're all going to get vaccinated, or we've all gotten vaccinated, and we're still worried about getting Delta and a breakthrough experience. So should we all be wearing masks even when we all know we're each other and we know we're vaccinated? And if so, is there a specific kind of mask that makes more sense for us?
Yeah, I think this is something people still have not fully understood, is vaccines are not an on or off light switch. They're much more like a dimmer switch. And your personal risk is a reflection of the vaccine effectiveness and the level of virus in the community. So if you have, say, a 90% effective vaccine, your risk is a 90% reduction from what is in the community. So let's say, I don't know, for just numbers' sake, you have a level of 100 in the community, you get vaccinated, you reduce 100 by 90%, you're down to 10. So 10 is not zero. You still have some level of risk. It's lower than it would be if you were not vaccinated, but it's not zero. Now, let's say the level of risk in the community is 1,000 instead of 100. You reduce that by 90%. 90% down is going to take you down to 100. And so, that's just to show you that even with a 90% effective vaccine, your own risk is really going to depend on what's happening in the community. And this is why there are diminishing returns on giving dose after dose after dose to already vaccinated people. Where you're really going to get the bang for your buck is giving doses to unvaccinated people, because that's what reduces the amount of virus in the community and thereby reduces your risk. So the other things that you can do to reduce community transmission, which is the most important thing after you yourself have been vaccinated, is of course, get as many people vaccinated as possible. But in addition to that, it does mean continuing to mask, at least in the short term, while there's still a lot of virus out there. And also paying attention to other things like indoor ventilation and air filtration, something that the New York City public schools are really trying to do, but not that many other places have done really effectively. And I think we really should be looking to places like the New York City public schools as a model for what we should be aspiring to. And that is an important piece of the puzzle here.
Great. And are we still recommending that people aim for the KN95 or KF94 type masks?
Oh, great question. Sorry, I didn't address that. Yes.
Okay.
Yeah. So if you are not a healthcare worker, if you are not working in a healthcare setting, for the general public, I would say a KN94 or a KN95 or a KF94, which are essentially equivalent types of masks, would be the preferred mask. These are better at protecting you than a surgical mask or a cloth mask. But they're not as uncomfortable as the N95s people like me would wear in the hospital. So I think it's a good balance between extra protection while still being pretty comfortable and wearable.
So I mentioned in the opening statement tonight that the city of New York is urging everybody, particularly elderly people and people who are immune deficient, to remember to get their flu shot as well. Is there anything we should know about getting a flu shot and getting vaccine shot, COVID vaccine shots in any particular order, or not at the same time, or with some number of days in between?
It really does not matter. You can get one before the other. The timing doesn't matter. You can get them together. They will still work great. I got my flu shot yesterday. My husband got his flu shot today. I would really urge people to get their flu shot. I've already heard of some outbreaks of flu on the East Coast. So it seems like we're dealing with an early flu season this year. So I would absolutely go to your local drugstore, pharmacy, primary care doctor, wherever you get your vaccines, and get a flu shot as soon as possible.
So you just talked about before that the Delta variant seems to be winning the mutation war, so to speak, of evolution of this disease. Because I even read that it's winning the war because it actually doesn't kill people. And since it doesn't kill people, it has more room to grow and spread. And that actually, the disease understands that from an evolutionary perspective. But do you have any, I don't know, crystal ball about where you think this is going and what's going to happen next, assuming we continue our trending towards more and more of us being vaccinated?
I think the big Achilles heel is all the people who are still not vaccinated, because that's really the incubator for more variants. And there's still a lot of the world that is not vaccinated. And in particular, Africa, you have less than 4% of people in Africa who've been vaccinated. A lot of Latin America is also lagging behind. A lot of Asia is lagging behind. And so that's really our Achilles heel. The Delta variant emerged in India before they really got started with vaccination, and then spread around the world. And that really set us back. The Delta variant emerged in the spring, back when we thought we were really turning a corner. We thought we were putting this pandemic behind us, and then Delta hit, and that really changed the game. And I think similarly, we really have to be very attentive to the fact that much of the world is still not vaccinated, and that's where the next Delta, the next variant is going to come from.
Got it. This is sort of a sidebar. Why can't you take Tylenol before getting a vaccination?
There are theoretical concerns about whether Tylenol, ibuprofen, other anti-inflammatories could reduce the effectiveness of your immune response to vaccination. I think that concern is greatest with medications like Advil or ibuprofen, naproxen, Aleve, those types of medications, less so with Tylenol. I would not preemptively pre-treat, but I think if you wanted to take Tylenol a couple hours after vaccination because you developed a bit of a fever or some muscle aches, I think that's probably okay.
Got it. Somebody raised the concern about not wanting to go to centralized locations to have tests done about whether or not they're sick because they're worried about the person being in the room right before or at the table next to them might have COVID and it's, all through the air and you have to take your mask off to do the test. And I'm just wondering, have we seen problems growing out of test sites where you have, people actually passing it to each other in test sites?
It's an interesting question. I have not actually seen that happen. And part of it is in medical settings, you have different standards for ventilation and air filtration. Those standards are higher than in other public settings. So I think you have an extra layer, an invisible layer really of protection that you may not even be aware of in those places. I think the other option is you get home test kits, which I know there's been a run on those. And so it's been difficult to get your hands on one at your local drugstore. But that certainly is an alternative, is to get one of these home test kits. Those are about $25 a piece, so not cheap, but that is another option.
And do you think that providing instant testing does actually offer additional protections to people when going to large events or going to big meetings? And should we be requiring this in addition to wearing masks?
Well, it all depends on how the test result is used. If the test result is used to say, oh, you tested positive, you cannot enter this event, you have to go home now, yeah, then it can be helpful. If that test result if the result's not coming back until the event is over, people have already mixed and mingled, that's not really going to be very useful. So it's all about what you do with the result that matters here.
This is a sad question because I think so many of us feel we've all been trapped at home for too long and too isolated, but is it prudent for older and at-risk people, even though they've been vaccinated, to stay indoors until the rates go down further?
I think it's important to remember that outdoors, your risk is really minimal. I think the couple exceptions to that are very crowded outdoor settings. So like going to a sporting event where everybody's crowded into bleachers outdoors, or a big outdoor concert music kind of event outdoors where people are crowded together. I think those would be exceptions to that sort of outdoor rule. But in general, if you're outdoors, your risk is going to be very low and you can take off that mask and be safe. And so I would really urge people, the weather is still nice, to spend as much time outdoors, socializing, seeing people, going to the park, do all of those things as much as you can before the weather gets cold. And then, once the weather gets cold, you'll have to reassess, what's possible, what's feasible, depending on where you live. But outdoors is really safe. For older people who've been vaccinated, in terms of indoors, I would really limit the indoor time to time when you are wearing a mask, and that it not be a crowded indoor setting. And I think at least until we can bring levels of virus down in the community more, I think that would be the most cautious path to take.
So, this questioner, I'm 75 years old. If I'm correctly masked, I've been vaccinated twice, but not yet 3 times. Is it safe for me to go to a Broadway theater?
I think this one is really about your, what level of risk you're willing to tolerate. I think if you're wearing a good KN95 mask, you are vaccinated, it really just is going to depend on that particular theater, how crowded it is, and what other things that they're doing. Are they doing anything for ventilation? Do they have any kind of testing requirements? Maybe not for the people in the audience, but for anybody working there, any of that. I think it's really going to depend on you and what level of risk you're willing to accept.
Another sort of, like heartbreaking question that I know people face. So again, will make me, 75 or up, but vaccinated. Can I visit my grandchildren who have not been vaccinated, given that we know the Delta virus is 1,000 times more, I guess, accessible through mouths and through whoever you see?
Well, I think the way to do this safely is to really make use of testing. And I think what you would want to be doing is having the kids tested really a week or so in advance, and then daily leading up to a visit, to be sure that no one in the household, especially the kids who are not yet vaccinated, to make sure that they are not carriers, that they're not infected. I think that's the way to do this safely. And then, of course, layering things like doing things outdoors as much as possible, opening windows and doors, indoor ventilation as much as possible, wearing masks, depending on what you're doing indoors. I think those are the things that you would have to consider layering depending on what activities you're pursuing. Sorry.
Yes, your dog needs something.
Yeah, my dogs are barking at somebody at the door. I apologize for that.
Okay. This is life in Zoom.
Exactly.
Real life in Zoom. Okay, so this is a little bit of a long question, but I know a lot of people are thinking about this. So what's the reasoning behind the city policy requiring one vaccine dose before you go to restaurants, gyms, etc., since getting fully vaccinated is so important? If the vaccine dose could have been administered the same day as the person gains entry to the restaurant or the gym, how does that actually make them or you any safer? And does that actually work against incentivizing people to get the second shot and to just go, okay, I had one, that's enough, now I can go anywhere I want anyway?
Yeah, it's a great question. And it's honestly why I still only dine outdoors. I have not gone back to indoor dining, despite the fact that I am fully vaccinated, despite the fact that this mandate is now in place. I think the thinking is that if people get one shot, they'll see, oh, it's actually no big deal. I survived. I'm okay. And that they will then get the second shot on their own. After they get the first shot, they're also entered into the system where they get called back and reminded to get that second shot. And so I think the thinking is that the big hurdle, the big mental and perhaps also physical hurdle is to get to that first shot. And that once people do that, then getting them to complete the vaccination series is a much easier job. But it is a good question, because one dose in particular of the Pfizer and Moderna does not leave you fully vaccinated. And as was pointed out in that question, you're not immune immediately after getting a shot in the arm. It takes about 14 days after you get a shot for that shot to really kick in. So I think it's really functioning as an incentive to get people to get that first shot, and that hoping that once they get that first shot, they realize it's something that's safe and they might as well get the second one.
I do think at minimum, the city's policies are a bit confusing to people. So there's someone else asking about that in the schools, teachers and staff only need to show proof of single vaccination. Although I think that there's in writing clarification that the policy is teachers and staff have to be fully vaccinated. So we're going to need to check on that. But I just want to go on record as saying, like, I agree with you. We should be doing everything we can to move people to understand that they need to complete the vaccination process, and that if it's a mandate for their job, I think we really need to make sure they understand it's not just once and done, unless you get the Johnson and Johnson, and that there is still the anticipation that it takes up to 2 weeks before you have a full response to the vaccination. Is that right?
Yeah, it takes 2 weeks after the shot in your arm.
Uh-huh.
So, if you're doing the Johnson and Johnson, it's 2 weeks after that first dose. If you're doing Pfizer or Moderna, it's 2 weeks after the second dose that you really have your full effect of the vaccination.
Got it. And I know before when I was talking about natural immunity when you've already had COVID versus the immunity from shots, you were explaining that actually really evaluating the level of your immunity is a very intensive sort of research assignment.
Mm-hmm.
But if you've never had any symptoms, is there a test that can tell you whether you've had COVID in the past?
They're imperfect. So if you get an antibody test, and you have to get the right one. So if you get the antibody test that tests for antibodies to nucleocapsid protein, that can tell you that you may have been exposed or infected in the past. It's going to miss some infections. It's not perfect, but if it's positive, it means that you probably have been infected in the past.
Got it. And it is possible for people to get mild enough versions of COVID that they might not really have been aware, right? Not everybody gets extremely sick.
Yep, that's right. In fact, probably the majority of cases are so mild, people don't even realize it.
Right. Okay, so this is technical. What is the COVID death rate for the fully vaccinated per hospitalization, and how does that compare to the hospital death rate before we had people getting vaccinated?
So that's a bit of a tricky question. So the overall death rate for people who have been vaccinated is very close to zero. And then if you look at people who have been vaccinated who end up with a breakthrough case that requires hospitalization, what is the death rate? It's going to be a little bit higher than zero, but still very, very low. And I think big picture, the key message with breakthrough cases, that means you, despite being vaccinated, you get an infection, you get sick. Where we see that turning south, so to speak, people getting really sick, ending up in the hospital, ending up dying, that has almost always been with cases in the nursing home, where you have very old people, people who might have underlying medical conditions, including immunocompromising conditions. And almost all of those have originated with either a caregiver or a visitor who was not vaccinated. And so if you're really trying to prevent those cases, it's really important to vaccinate not just the nursing home residents, but to make sure their caregivers and their visitors are also vaccinated. Now, on that front, the Biden administration is using its leverage through Medicare and Medicaid funding, which a lot of nursing homes rely on as a major source of funding and payment for their services. The administration is using Medicare and Medicaid funding to really require that people working in nursing homes be vaccinated. So at least the staff, there are levers to make sure that they are vaccinated. I think where it gets trickier is with visitors. So it could be family, it could be friends, but visitors to nursing homes, how do you require vaccination of them? I think is much more difficult, but that is really sort of where there's still risk for people in nursing homes.
Got it. Okay, so travel, flying, you're vaccinated, you're wearing a mask, you're still on that airplane for probably quite a few hours, and the air is recirculating through the through the plane. Is this still a higher risk exercise that people should really think carefully about before they get on an airplane?
I would think carefully about getting on an airplane, depending on your own personal level of risk. So are you somebody who's older? Are you somebody who has a highly immunocompromising condition? I think if you fall into one of those groups, I would really think twice about traveling, especially before you get a third dose of vaccine, because those are really going to be the two groups that will be eligible if they aren't already. I think the challenge also with flying is that you're in a very closed, very dense space with people. The ventilation systems in planes are actually pretty good, but you are still at risk from the people sitting near you in your immediate vicinity. And I think for a lot of people, they do want to take their mask off when they fly, either to eat or drink. And so that's another challenge. If you're able to fly and not take off your mask, your risk is going to be lower. If you feel the need, if you do take off your mask, that does mean you're opening yourself up to risk. So I think, some of this needs to be personalized by your age, by what you're willing to do, by the length of the flight. And that really should be what guides you in your decisions here.
Got it. And I don't know why we think you would know, but let's ask you anyway. If you are going to decide to go do some international travel, are there any countries you think it's safer to go to, or countries you think you really should not go to?
I would look, so the CDC website, it's cdc.gov/travel, and click on the country you're looking to travel to. There is great information there, not just about the local situation with COVID, but also other infectious diseases, other travel risks. And so I think that's a really good resource for helping you sort some of these things out. Depending on where you're traveling, you may also want to go to a travel medicine clinic, especially if you're traveling, for example, to a less developed country in Africa and in Latin America and Asia, as an example, where they can help you with some of those less common vaccines like yellow fever vaccine. So that's what I would recommend. I think big picture with respect to COVID and travel, what you're looking for is a low incidence of disease, low rate of infection, and then high levels of vaccination coverage. And so those are the places with respect to COVID that are going to be the best, the safest to travel to. I will say the United States is quickly becoming a bit of a world pariah as a place, for our tourists to travel from, for people to travel from other countries to travel to. And it's because our vaccination rates really are lagging behind much of the world. I think we rank something like 40th in the world right now with respect to vaccination rates. Our transmission rates are among the highest in the world. And so we really, it's a bit of a national embarrassment, frankly, on the world stage where we are.
Mm-hmm. Okay. So we've, I think, decided as a state that we're not recognizing religious exemptions from mandates for COVID vaccines, and I support that. But are there health conditions that specifically would be a reason not to get a COVID vaccine?
They are very rare. There are some people who have had very severe allergic reactions to the vaccines, but because we have multiple different kinds of vaccine, say you had an allergic reaction to Pfizer or Moderna, you can get the Johnson & Johnson. If you had an issue with the Johnson & Johnson, well, you've already gotten the one dose, you're done. And if at some point in the future you need another dose, you have Pfizer and Moderna that you have as alternatives. So I think that's number one. Number two, even with giving a second dose of either Pfizer or Moderna, this has now been studied. Could you give a second dose after an allergic reaction and do so safely? And that has been shown that it can be done. What's often done is patients are pre-medicated with something like Benadryl or a steroid before giving that second dose. And that seems to work quite well. So allergy, even anaphylaxis, which is a severe allergy, does not seem to be a reason not to get vaccinated. Really, the only reason I have been able to come up with, which was something that I realized on the wards at Bellevue, taking care of somebody, was somebody with hemophilia, untreated hemophilia, where if we had given them a shot in the arm, it would have caused a lot of bleeding. And so it wasn't so much the vaccine itself, but rather the injection, the needle. And that's the only situation I've been able to come up with all of the patients I've seen, all of the data I've seen, that there's really a medical reason not to get vaccinated.
And in some vaccines, they've come up with oral versions. Is that expected as a possibility with this vaccine?
Yeah, so a great example of this is the typhoid vaccine. There is an oral typhoid vaccine. There are oral and nasal vaccines for COVID that are under investigation. They're still in phase 1 clinical trials, so we're still looking at a few years before those would be ready for prime time. And I don't think those will replace the current injectable vaccines. I think those will be in addition to. The current injectable vaccines are very good for inducing immunity in your bloodstream, in your internal organs. They're not as good for inducing immunity in your nose, your throat, your mouth. And this is also part of the reason why the vaccines may protect you against severe disease. So you're getting protection in your lungs, for example, but they may not protect you against an infection in your upper airway, in your nose. And so this is where down the line, a nasal or an oral vaccine may help produce that upper airway protection that the injectable vaccines don't.
That makes total sense. Thank you. I know the answer, but I just want to ask it so you get to answer it. It is okay for pregnant women to get vaccinated.
100%. In fact, I strongly recommend, and it's not just me, it's also ACOG, which is the American College of Obstetricians and Gynecologists, and other similar groups are also very strongly recommending, if you are trying to get pregnant, if you are breastfeeding, please get vaccinated. What we have seen, in fact, in the last month or two, the most women, pregnant women have died from COVID in just the last month or two nationally. If you get COVID during pregnancy, this can be really deadly for you, for your pregnancy, for your baby. We see a much higher rate of stillbirths if you get COVID during pregnancy. So absolutely, please get vaccinated. If you're trying to get pregnant, you are pregnant, or you are breastfeeding.
Good. I feel like I did know the answer to that one, but I did not want this show to be completed without making sure we had that said by you, the expert. Thank you. And then I just have one more question here that came in. So this is about being nervous about even not taking the mask off outside. So this person's concern is, since it's an airborne disease, that even if you're outdoors, aren't there going to be droplets from other people's breath in the air, and that you could walk behind someone even 10 minutes later and still be exposed to their COVID?
So what happens when you're in the great outdoors is you can almost think of it as dilution in an infinite amount of air. And so then the dose of virus that you get when you're outdoors is really infinitesimally small, with the caveat that if you are in a crowded outdoor setting when there's not a lot of good air circulation, so again, like you're in the bleachers, tightly packed at a baseball stadium, outdoors, or you are at a outdoor concert, but you're packed in together, those would be situations I would think twice about. But in general, if you're outdoors, people are, spread out as they are normally outdoors. You're walking down the street, you're taking your dog for a walk in the park. Usually those are not very crowded settings, and there you can consider the ventilation you're getting in those settings to being that you really have almost infinite dilution of virus particles in the air.
Thank you. Just touching on, you were talking about how few cases you had in Bellevue at this time. We're hearing that actually some hospitals are much fuller and even have fairly high rates in their ICUs still. Do you know what's bringing on different patterns in different parts of the city or the state?
I think this is related really to two different things. One is vaccination rates. So vaccination rates across the city are not the same. You have some boroughs that have higher vaccination rates than others. So Manhattan, for example, has the highest vaccination rate. Staten Island is the lowest. And so that means you're going to have more disease in Staten Island. Some of this also relates to how people work, how they live. So what proportion of people living in that neighborhood are working, are essential workers, where they're going to be more highly exposed, having more interactions face-to-face with the public. People who cannot work from home are going to have higher exposures, many of them. And then in some neighborhoods, you're going to have also more crowding. So more people living in an apartment. And we have definitely seen a correlation between crowding and greater risk of COVID. So neighborhoods, Elmhurst Hospital, we all saw in the news, was hit extremely hard early in the pandemic. And I would predict, and as I know, they have more COVID as a result, even now, because of how people in their catchment area, what their risks are. And so I think that's really what you're seeing play out are those differences in vaccination rates and then baseline level of risk.
Fair enough. A couple more questions came in. So given your position that you would not go to an indoor restaurant at this time, what's your feeling about indoor fitness or spin classes, where again, you only have to prove one vaccination to be allowed in under the rules?
Yeah, for me personally, I approach all of those the same, whether it's indoor fitness, indoor bars, indoor restaurants. Indoor fitness, in theory, you could continue to wear your mask. You're not necessarily having to eat or drink, although a lot of people will drink water or a sports drink when they're in a fitness, in a gym, in a fitness center. In theory, you could keep your mask on the entire time. However, you're also breathing much more heavily, as are all the people around you. And so it's a bit like when people are singing or shouting, when you're breathing more heavily, when you're exhaling more heavily, the amount of virus you could be putting into the air is going to be higher. And so to me, that's still a pretty high risk situation.
So also when you're in a gym, you're sweating, or I am. Is exposure to sweat just as contagious as exposure to someone's, breathing at you?
No, there's not COVID in the sweat. It's really in your respiratory, in your exhalations and your respiratory secretions.
Okay, that's good to know. All right, the final question, and I have no idea what it means, so I'm counting on you two, or you could say, I don't know. What is your position on Ivermectin protocols as put forth by the Frontline COVID Care Alliance as treatment? And what is the basis of your opinion?
Yeah, so ivermectin, this is a medication used to treat parasitic infections. It's used in veterinary medicine. You may have heard about horse paste that people are consuming for treatment of COVID. Ivermectin does not work for treatment of COVID. This has now been shown in multiple studies. It is also dangerous. And this is just the same conversation we were having with hydroxychloroquine and convalescent plasma, and now it's ivermectin. It's anything to not get a vaccination. And I would really strongly counsel people, one, if you're going to, quote, do your research, doing your research is do not go out and Google. It's not about going on social media. Those are really bad places to get information. What we have seen with the Google search algorithms, they actually take you down a rabbit hole of disinformation, bad information. So if you're, quote, going to do your own research, go out and get a degree in epidemiology and virology and immunology, and then assess the data, the primary data, the primary literature. So in other words, the actual publications, not what somebody has regurgitated on social media or on a blog or whatever. And I would bet most of people here don't have the time, energy, desire to do all of that. And if that's the case, turn to real experts, people who have gone through that training, who do review the primary evidence, not again to social media and Google, because that's going to take you down this rabbit hole of misinformation that's going to lead you to things like ivermectin.
Well, that was a perfect closing question for you, because like all the other answers, it shows us how knowledgeable and thoughtful and prepared you are, and how much we appreciate, Team Krueger and everybody who was listening tonight, that you would give us, an hour and 15 minutes of your valuable time to go through these kinds of questions and answers. Because as you can see, this many months into the pandemic, we still just sort of have endless questions that we need answered. So Dr. Gounder, thank you so very much for being with us tonight. And I want to share with everybody listening that they have a couple of additional upcoming events. Next Thursday, September 30th from 7 to 8:30 p.m., I'm hosting a Supporting Your Child's Emotional Wellness, Adolescent Mental Health During COVID-19. We will hear presentations from the City Department of Health and Education and from a parent who's a president of the Community Educational Council for School District 2, right here in Manhattan. Most parents are recognizing that there are new emotional issues for their children and particularly teenagers during this pandemic. And it's very important, I think, for anyone who has children or grandchildren to know what signs are and what can be done before something tragic happens. And then the following week, on Thursday, October 7th, from 7 to 8:30, we'll be hosting a town hall to give the public information on the 5 initiatives that you will find on your ballot when you go to vote in the upcoming November election. You might think you're just voting for your mayor and your borough president and your council member and your public advocate and your controller. But actually, when you turn the piece of paper over, there are 5 ballot questions on the back, including proposals about redistricting, same-day voter registration, no excuse absentee voting, and establishing a right to clean air and water in the state constitution. So most people have no idea that that ballot's going to have 5 questions. So we're going to have people to just give you the facts about what these questions are, and then you will decide how you wish to vote on those questions. So I want to thank you all for coming. Remind everybody, continue to wash your hands, avoid large indoor and outdoor gatherings, wear masks in public indoor settings, and if you're nervous, wear them outside too. It can't hurt. And that's, of course, even if you're fully vaccinated. If you know anybody who is still vaccine hesitant, please do everything you can to encourage them to get vaccinated, if not for their own sake, for everyone else's sake. It's also important that people get tested for COVID-19 if they develop symptoms or exposed to someone else with an active case of coronavirus. Even if you are vaccinated, the more we do for ourselves, we are actually doing for others as well. So again, Liz Krueger, thank you so much for joining us, everyone, and we'll see you at the next town hall.